Hello and welcome to this month's Picture of Health. I'm your host, Lauren Lengyel. Today we have the pleasure of being joined by one of our own residents of Polk County who is trying to make an impact on a global scale. Hardam Tripathi, a graduate of George Jenkins High School, has recently returned from a summit in Washington, D.C., where he shared a presentation about malaria and how it could potentially impact the state of Florida. Welcome to the show, Hardam. Thanks so much for being here.
Thank you for having me. Appreciate it.
You know, when you walked in, I wasn't expecting someone so young at first, but I'm so glad to see that you have such energy to bring to the cause.
Yes.
So tell me a little bit about how, obviously we know you went to George Jenkins, so what happened after George Jenkins? Where'd you go off to college?
Yeah, so I decided to stay pretty local actually because Polk County is my home. I've been here for about 25 years. I've been a resident here. I graduated George Jenkins High School in 2008 and ended up actually going to the University of South Florida in Tampa. And then I did my business degrees there, my management and marketing. But then I really decided that I wanted to do something in healthcare and something with legal and compliance and regulatory. So I decided to go to University of Florida, where I actually did my master's degree in pharmaceutical outcomes and policy. And then after that, I said, you know what, let's get a legal background. Let's kind of see, let's come from a legal standpoint and kind of understand the world. It opened up my eyes. I got an opportunity, great opportunity to be accepted to Western Michigan University and had a great stint there. And that actually opened up my eyes because I had the opportunity to actually go into DC and do a lot of stints with the federal government as well as with state governments, and to do a lot of clerkships and legal internships that really opened my eyes from the public health side and from the legal side. So that's kind of how I ended up in law school, and it kind of brought me in my interest to really do more for the community and serve.
So when you're doing these clerkships, are you learning about, topics and concerns, for our country that maybe you didn't pay much attention to before?
Yes, exactly. Yes, especially at some of the bigger departments such as the Department of Justice or Department of State, where you really get to really learn more about a lot of the different variety of issues that kind of affect global citizens, but also local citizens as well. So it's very neat.
So how did you get to the part where you're working with Nothing But Nets?
Okay. Well, I was actually working with the United Nations Foundation, and I actually had the opportunity to go to a leadership summit. And at that leadership summit, I met a lot of my colleagues, and one of my colleagues found out that I had had a background in pharmaceutical outcomes and more of the policy side of things. And one of the biggest things was that she said, well, you have a healthcare background, you'd be a great asset to our team with respect to Nothing But Nets, which was another separate campaign of the United Nations Foundation. So because of her and her giving me a lot of the insights, one of my colleagues, I was able to actually become a Champions Councilman on the Nothing But Nets initiative, which actually led me to go to DC and lobby for a lot of different issues involving public health and the combating malaria.
So at the opportunity that you were given by one of your colleagues, was that postgraduate?
Yeah, well, it was actually during law school. It was actually during my final year, and it kind of transcended into post-grad as well. So it was something that I continued the work of fighting malaria and other public health diseases like tuberculosis, Zika, and many others, mosquito-borne diseases. So
that's amazing. I think the most interesting thing I did when I graduated was, sleep for 9 hours. But
can't go wrong with that.
You are definitely, putting your degrees to work, which is awesome, and that knowledge.
Thank you.
So you're working with this program. So why was it just out of hey, you could really be an asset? And then if that's the case, then how did you, wrap your head around this whole malaria epidemic?
Yeah, that's a great question because it was more about interest. Like I said, I've always been really interested in public health, but for me it was more so from a national security standpoint. I was offered, and I had an offer coming out of law school to join the United States Army JAG Corps upon bar passage. So I am still taking my bar exam, and upon passage I do plan on joining the U.S. Army JAG Corps. And based on that, I really found out that service members are the ones who are really afflicted by this disease when they're overseas, especially at some of our bases in sub-Saharan Africa. And this is something that our active force, active deployments, service members, their staff. These are all people, U.S. citizens that are affected, and service members who are affected by this disease, that if we actually put in the legwork up front, we could actually end up saving lives, having an active duty force, readiness of force, and actually have people who can actually protect our country and our interests from a national security standpoint. So it was just, it was something that I thought that was very beneficial. I thought that going into the JAG Corps, this would be something that I would be dealing with too. If one day maybe I was to go to Africa, then I would want to be safe, and I would want my physical well-being to be something looked at. And I think that when you're a service member, that's something that you should always keep in mind, is your well-being. I mean, malaria is the #1 killer for service members overseas. So especially what's been cited by the Department of Defense is that that's something that they've really tried to focus on, working with the Centers of Disease Control as well as with the NIH. So this is something I think is a community effort that we can definitely all get behind, because it's bipartisan, it helps our service members, and it's something that we can all work towards.
Absolutely, and I think that more of us have service members who are part of our family, or our friends, and we certainly want them to, be safe, and especially when they're defending our freedoms that we enjoy here. So tell me a little bit more about, well, actually, let's back up for a second. So malaria, let's start small. For some folks, some of our viewers may not know exactly what malaria is. So can you explain that?
Yeah, so malaria is basically, it's a public health crisis actually overseas, but actually we have about 1,700 cases on average as reported by the CDC in the United States. But malaria is basically a disease, it's a mosquito-borne disease that's actually created because of this female mosquito. It's called the Anopheles mosquito, and that mosquito actually ends up biting people, or biting people who have the actual disease itself, and the saliva mixed with the plasmodium, it's actually the parasite that's in the mosquito, that when they bite, the saliva mixes with the blood, and the plasmodium then infects the red blood cells. And as a result of that, the mosquito then has that disease in it, and then it goes and bites someone else. Now you have a transplantation of this disease now spreading to another individual. And so usually when that saliva and the blood mixed with the previous member now gets joined in with the new person who gets bit, now you kind of have that like that disease spreading to another person, which can kind of yield to the whole malaria disease spreading to various amounts of people. Usually this is very dangerous for pregnant women as well as young children, which vast majority of the individuals who die are actually children, young children, and that's I think that's very wrong. I think that's something that we all can get behind, is that you don't want young children to die. Disease really doesn't have any borders. It's something that we should all kind of get behind. And that when you look at it, when you have pregnant women and children dying at a systemic level, that's not okay, not only from a global standpoint, but from a community standpoint. It's also spreading, and it can be prevented if we just kind of put in the legwork up front. So it's definitely a disease that's preventive and is curable, but for some populations and subsets, it can be very dangerous, and some of these places and regions don't have that kind of power to help their citizens. So I think it's up to us to kind of help them out, because it ends up ultimately affecting our citizens here in Polk County even. So
absolutely. So let me see if I can get this right, because like I said, for some people it's harder to wrap your head around. So this starts with the mosquito, and the mosquito carries a parasite?
Yes, it's called the Plasmodium parasite.
Okay. And that mosquito will bite a person, and the parasite with the saliva and the blood of the person, basically the red blood cells of the person become infected by this parasite.
Yes, ma'am.
And then at that point, that same mosquito can move on and continue biting people, or uninfected mosquitoes can bite a person who has malaria and also spread it that way.
Yes, ma'am.
So I can see how that would be a very tragic and difficult thing to control.
Very true.
Absolutely. It's time for a quick break, but stay tuned for more information about malaria and Hardam Tripathi.
Observe a domesticated human family in their natural habitat, known to their species as the backyard.
Hey, you think I should light it now?
I think it's good.
Yeah?
Oh dear, someone is about to burn a pile of debris that's too tall, which can start a wildfire. Wait, could it be? Blimey, it is.
It's Smokey.
It's Smokey Bear. What a legend.
What's he
Hey,
doing
it's
here?
Smokey. Sorry, it was too high. Right.
Watch as he astutely ensures that there's no wind, and how he removes some of the debris to create a smaller, safer burning pile.
Told me to make it big.
No, you said make it bigger, baby. The bigger the better.
Take note of
Right.
our fearless furry friend here, humans.
I appreciate it. Fist bump.
Watching you.
Smokey's done it again.
Bye, Smokey.
Only you can prevent wildfires.
Don't wait. Communicate. Make your emergency plan today.
Welcome back to the show. In case you're just tuning in, we're joined in studio this month by Hardam Tripathi, a resident of Lakeland, who is raising awareness about the effects of malaria in Polk County in Florida. So right before the break, we were kind of talking about how this disease is spread from person to person by insect, parasite on an insect. So in that, it's very easy to understand how this is such a widespread issue, malaria. So what are we doing to kind of combat that globally, and then here in Polk County, how are we raising awareness about it?
Yeah, that's a great question. Globally, to answer that aspect of it, we actually are fighting it from a global standpoint with respect to the President's Malaria Initiative. And what that is basically it's a fund, and there's appropriations committees that Congress usually appropriates a certain amount of funds to help people overseas for global aid efforts, because it does ultimately have a United States interest. There's some sort of interest that we have that does go along with actually helping our global counterparts. And so there's a global fund, which is a fund that the United States, AID, the Agency for International Development, as well as the Department of State, they both work with that global fund, or excuse me, with that global fund, excuse me, and then with the President's Malaria Initiative, that's something that is part of the United Nations framework, and they also work with, it's created by George W. Bush back in 2005, and it's something that's created in an effort to actually combat and raise awareness and provide insecticidal nets for individuals overseas. That's what we're doing from a global standpoint. From a domestic standpoint, something more local even, there's a lot of partnerships with the Florida Department of Health that we actually partner with their epidemiology divisions, with some of the local universities such as University of South Florida. So some of our partners in education and academia, as well as with the state and local governments, I think are all partnering up with local activists such as myself and other nonprofit groups and NGOs. And what they do is they basically end up partnering up to actually educate citizens not only in Polk County but in other counties as well, neighboring counties such as in Hillsborough, Pinellas, what may be it, you know. But ultimately it's just a joint effort. It's a collaborative effort with our state and local government along with NGOs and nonprofits. So it's kind of it's a big effort. It's a partnership basically.
I think some people in Polk County would hear about what you're doing,
right,
and say malaria is an African disease. Like it's not. This is not. Why is this important to Polk County for us to be aware?
Yeah, this is very important to Polk County, especially its residents, because when we think about a disease like malaria, out of sight, out of mind, right? It's really not the case, because if you think about it, we have a lot of tourists who come here, we have a lot of immigrants who come to Florida. Florida's a hotbed for the tourist industry. It's a great place for immigrants to move to because of kind of what Florida, the great state of Florida, has to offer. And so because of that, a lot of the regions, such as in Haiti and the Dominican Republic, a little south of the Keys even, I mean 90 miles is Cuba, there's a lot of these island nations that we have in the Caribbean as well as in South America. And the Nothing But Nets initiative has actually expanded there because they have seen that there's a need and a rise in malaria type incidents. And when these people come to Florida, they come here and they travel in a mosquito where we are prone to having hurricanes, and we have a environment where it's more temperate, that's a little warmer. It's a hotbed kind of for mosquito growth. Mosquitoes are going to grow here, a lot of them, and there's an opportunity for those mosquitoes to then feed on immigrants or on tourists who come here from these malaria-inflicted regions. And then when that mosquito bites that person or that individual, it can then go and actually affect someone, a Polk County citizen shopping somewhere in like an area where there may be pools of water where now mosquitoes are laying eggs, and then these eggs are going to eventually hatch and more mosquitoes are going to come, and it's a cyclical process. And if we don't actually look at it and we don't combat it from the front end, it's going to come back and bite us, no pun intended, on the back end. So this is something I really think that citizens should be concerned about, because it's not something that we see daily, but if we don't actually use those preventative measures, it could be something that could be some sort of an outbreak, and instead of having those 1,700 cases, it can exponentially increase, because this is something that, even though it's out of sight, we do need to keep it in our mind.
What are some of those preventative measures?
Okay, so some of the preventative measures that actually Polk County residents, even with the Department of Health, that they're actually doing is educating. That's, I think, the #1 important thing that we can do, because it's not so severe like it is in some of those sub-Saharan nations, sub-Saharan African nations, where we need insecticidal nets. We have good housing here, good infrastructure. So things like that will actually prevent a little bit of kind of like the mosquitoes from biting people and spreading that malaria.
Sure. I've always heard that you're supposed to, dump out all your buckets and stuff like that.
Yes.
That's the only thing I've really heard in terms of prevention. But yeah, we're not really much for needing mosquito nets just yet.
Yes, definitely not.
That's good. So beyond that, mosquito nets and things like that, what other preventative measures should people in Polk County be taking? Well,
people in Polk County should probably, like you said, with the buckets, when there's a lot of water, like when it rains and you have like your garbage can or something and there's a whole bunch of water pouring in on it, try to get rid of it the next day. Or if you have like pockets of water, try to get rid of that, because that will aid in reducing the amount of mosquito activity. Also, another thing they can do is stay aware, stay engaged, engage with your local departments of health, engage with your congressional members, who are the ones who are in charge of appropriating those proper funds to be allocated to these funds, because if the proper funds, ultimately it comes down to money. If the money is being allocated wisely and being appropriated wisely, then you have more outreach and more help from the government to help the individuals, making sure that they don't contract the disease, because now there's funds and there's beds being sent to other countries, and there's other preventive measures even at the local level where you may have, they will put pesticides of sorts where they'll kill some of the mosquitoes, the female mosquitoes that are the ones actually spreading the disease. So I would just say more awareness, more education, more diligence on behalf of the citizen, I think can go a very long way, because right now it's not a severe issue in Polk, but it could be if we don't, if we let our guard down. I think that could be something that could potentially spread. So.
I believe I read in a recent article that you were doing work in Hillsborough County and Polk County.
Yes, ma'am.
In terms of awareness. Are they events, or are they kind of campaigns, or just kind of a fresh new, hey, we need to talk about malaria? What types of things have you been doing?
So that's actually a great question because advocacy is very important. I think every citizen should be involved in the advocacy process, and the whole event that we actually threw involved an event in Hillsborough, but with Polk residents coming and attending the event, as well as even going to Polk County and actually going door to door or talking to people, social media, utilizing the network basically to spread the message. But basically what this event was we had 4 members. We had the United Nations Acting Deputy Director, Andy Gittow, actually come down as our keynote to speak about the public health problems that are in our country as well as overseas. I was actually the moderator, and I moderated a panel discussion with the acting deputy director along with a representative from the Florida Department of Health's Epidemiology Division, who actually came in and also spoke about some of the preventative measures that they take to educate citizens in Polk and in Hillsborough. We also had a lot of students who are PhD students at the University of South Florida, both in the Lakeland and Tampa campuses, who came in and actually talked about what they've been doing in terms of research, anti-malarial research. What are they doing to make sure that they create vaccines, antibiotics, prescription medications? What are they doing ultimately to help with this process to combat malaria from an academic standpoint? So we had not only someone from a United Nations global standpoint, not only did we have someone from a state level, from a community level standpoint, and not only do we have someone from academia, but we actually had people who were actually afflicted by malaria themselves. We had students who came in who had came to America, who were at the University of South Florida. People from Haiti come in and share their personal stories of what it feels like to go through malaria. It's not a walk in the park. It's very, after the onset, 10 days later, people get afflicted and they have fevers and symptoms that are like flu-like symptoms. And people can die. And we actually had people come in, actually give testimonials, live testimonials of what it felt like, what it was to actually contract malaria in some of these lower socioeconomic type nations that did not have the infrastructure or the economics behind it. So it was pretty moving.
That sounds very, very moving and very interesting. Do you recall any particular story that you might like to share with us?
Yes, actually one of my law school colleagues, his name's Ricardo, he's actually a good friend of mine. He actually went to the summit with me, and he was in Haiti. He was actually in Haiti, and he was born in Haiti, but he came here to go to law school, and he actually suffered from the disease, and he told me it was debilitating. It was something where he couldn't eat. I mean, he had trouble swallowing, he had fevers, chills. He just couldn't, his quality of life just dramatically decreased. And he said that because of these global funds, because of active citizenship from people in Polk County, from people in Hillsborough, people in the United Nations, these people, because of that and the funds that helped him get better, now he's able to practice law. So it's something like that you really look at, that these funds do impact people at a local level. This isn't just something where we don't see it. It's impacting our citizens, American citizens here who went through that disease, but because of these funds and because of a little bit of money that we allocated appropriately, that now they can have a better quality of life and they can continue to progress and do well and give back to the community.
Yeah, and I think the key there is to give back.
Yes.
Certainly you get out of it what you put into it.
Exactly.
So what exactly, okay, so I know that when a person contracts malaria, their red blood cells are affected. What actually happens in the body? What's going on there? So
your body actually starts shutting down. A lot of the organs start getting affected. If you look at the lymphatic system, you look at the blood cells, you see that once it's kind of like the core. Once it gets affected, it spreads malignantly. So your body just starts shutting down slowly. So it's a slow dying process. And basically your organs, because the organs are made up of these cells, will get affected cell by cell. And basically you have cells just blowing up inside, and you just kind of have the organs just dramatically shutting down. Heart failure, congestive heart failure, liver failure. It actually, the Plasmodium parasite that I was actually telling you about, it can stay in the liver for days at a time, and you might never know. And then suddenly it might just come out, and you might have liver failure, you might have liver malfunctions, and that can actually stay in your liver. The parasite then spreads, and then it just slowly starts shutting organs down. So you might have liver shutting down, your heart shutting down, and to severe cases, it can even affect pregnant women who have their baby inside. It can kill the baby, and then at that point, now you have a miscarriage. So it's very unfortunate, but if this is something that's preventable, I mean, it's based on these initiatives, it used to be that one child was dying every 30 seconds, but because of the efforts of the United Nations, as well as what I'm doing, as well as some of my colleagues and some of the Champions Council members, now instead of one child dying every 30 seconds, we're having one child die only every 2 minutes. So it's an improvement.
That's an improvement, certainly. So I know vaccinations, usually you only are able to get a vaccination if you're going to a high-risk area for malaria. Is that still true?
Yes. Well, vaccinations sometimes don't work because the parasites or the disease itself actually is not as receptive. It'll fight back. And so sometimes these vaccinations don't work. The Centers of Disease Control are actually in the process of still going about finding and doing more research to actually find vaccines that work, but for the most of the time, it's more the prescription medications that work the best. But after a while, there's a resistance that's formed, and so it's kind of good not to kind of stick more to the preventative side, and not really focus on the treatment side. If we can prevent it, then we don't have to treat it,
right,
in a way, if that kind of makes sense.
Right. So when someone contracts malaria, I guess the likelihood that they'll survive. What is that dependent upon? Obviously, probably where they live and their access to medication. But how do we treat that? What are they? Is it a hospitalization type situation?
So basically, it's all about positive health outcomes. You want to have good doctors, you want to have good medical staff, you want to have the right medications. A lot of these regions, if you look at Djibouti or you look at Eritrea or you look at Sudan and some of these sub-Saharan nations, they don't have access to the right medications. They don't have access to a lot of the even the nets or anything that they need to actually make the citizen better. So a lot of the times, it's not about can we treat it? It's more about how can we treat it. And so what I mean by that is they can treat it. Sometimes they'll have the drugs, but how can we treat it if we don't have enough of the drugs? Right. So it's kind of it's more about the access to medications and the access because of the lack of transportation, lack of infrastructure. I mean, sometimes you may have the medication at a hospital, but you may have a village so far away from the hospital. How are you going to get someone to walk miles and miles to get to the medication when they're sick? So it's kind of how do we actually treat it? We may have the medication, but how do we get it there? The logistics behind it are a lot more involved. So definitely something to think about.
Yeah. So would it be accurate to say that if a person did contract malaria and had access to that medication, that their outcome would be very positive?
Yes, more likely than not. Like I said, it's a case-by-case basis usually, but more likely than not. And I'm not a medical professional, so I don't want to give you, that exact number. But from what I've seen and the research that I've done, along with being involved in this kind of arena, this public health arena, I would say more likely than not, though, most people are treated by these prescription medications. But every now and then, you may have an individual whose body will build a resistance to it, and it may not work. Or if someone's a young child, their immune system might not be as strong. So by the time you even get to the medication to them, their immune system fails because they're so young. Like I said, most of the people who die because of this disease are their children and they're pregnant women. So because their immune systems are so weak, they can't combat that disease as fast as maybe someone of normal health or middle age could. So.
Well, Hardam, it's the end of our show. But I have enjoyed talking with you and learning. I really appreciate everything that you've been doing and the initiatives you've been involved in. And I certainly wish you great luck on the bar.
Thank you very much. I really appreciate your time, and thank you very much for having me. It's been a great opportunity, and I hope Polk County citizens will appreciate these efforts and get involved because it's one person at a time. That's all we can do.
Absolutely.
So, thank you.
Thank you. Unfortunately, that's all the time we have for this month. If you'd like to catch this episode again, you can tune in to PGTV on Tuesdays, Thursdays, or Saturdays at 2 and 8 a.m. and p.m. You can also find this and all of our previous episodes on the Polk Government YouTube channel. I'm your host, Lauren Lengyel. Thank you for joining me on this month's Picture of Health.